disparities. The stories I've heard over my career working in healthcare advocacy are legion. What is most surprising is that these stories were primarily told here in the U.S., the richest nation on earth. Other highly developed countries are able to help people access all medically necessary pharmaceuticals in an affordable manner. I believe that we can do this as well, a belief that was also publicly expressed by both Presidents Trump and Biden. We have the opportunity during this session to move forward toward fairness and affordability of pharmaceuticals as part of the work of making healthcare more affordable. Thank you for sharing your time and expertise together today, as together we work for solutions toward making healthcare more accessible and affordable for all Oregonians. And so I'd like to call our first witness, Representative Rachel Prusak, who's a co-sponsor of this bill. Welcome, Representative Prusak. If you could introduce yourself for the record.
Thank you so much. Good afternoon, everyone. Chair Pattison, Vice Chairs Knope, and members of the committee, for the record, my name is Rachel Prusak, the state representative from House District 37. I'm also a primary care provider for homebound community members with physical disabilities like MS and Parkinson's, or cognitive disorders like dementia and schizophrenia. Prescription drug spending is a problem that we're all familiar with. Rising costs have become a universal dilemma in our country, and the consequences have real-life impacts for everyone. Increased costs for the entire system, lower coverage and tighter budgets for our state-sponsored health programs, and a financial burden on all patients, insured and uninsured. All patients are negatively affected by rising costs, but they are not all affected to the same degree. Often when insurance plans see the rising costs of prescription drugs, they are forced to decrease coverage. And insurance should not remove access to medication based on costs, and a person's health should not be dependent on their ability to pay unnecessarily high prices. Because I care for people where they live, I get to know them and their families in an intimate way. I sit at the table with them while they ration their medicine or discuss how to balance paying for medication and food. And we can do more for these families. Today, I proudly present Senate Bill 844 as a response to this urgent issue. This policy gives stakeholders from across our communities a voice in the conversation around prescription drug spending. Representatives for patient advocates, healthcare workers, insurance, benefit managers, and yes, drug manufacturers will all have the opportunity to come together to form a real solution for Oregonians. Up to 23 stakeholders will be appointed by the House Speaker, the Senate President, and the Governor to a Prescription Drug Affordability Stakeholder Council, which will advise the smaller Prescription Drug Affordability Board, which will consist of 5 individuals and 3 alternatives appointed by the Governor and confirmed by the Senate. The Prescription Drug Affordability Board established within DCBS, will have the authority to place upper payment limits on prescription drugs that pose an affordability challenge to the healthcare system and patients in this state, particularly those with costs that create health inequities. This will be done through a specific and detailed process. First, the board will identify drugs that meet specific predetermined criteria for an affordability review. These criteria are based on the cost the manufacturer sets. Secondly, the board will go through a series of considerations to determine if the prescription drug has created an affordability issue or a disparity in Oregon. This includes consulting the Stakeholder Council to hear a variety of perspectives. Lastly, if the board decides that a prescription drug has, in fact, created an issue, they may set an upper payment limit for that drug. Oregon won't be the first state to enact this affordability review process. 2 states have enacted it, and 4 are currently looking at it alongside Oregon. Senate Bill 844 was drafted with the success and failures of these other states in mind. We avoid a conflict with the Commerce Clause by making sure that upper payment limits apply to all sales and reimbursements in Oregon only. We've also ensured the board's activities will be properly funded. The board will have the authority to set and assess fees to be paid by manufacturers. These fees will be deposited into a prescription drug affordability account. Initial board operations will be funded through an appropriation from the general fund, which will be promptly returned. Prescription drug prices are a matter of life and death, and their use is only as valuable as people's ability to afford and access them. The Oregon Prescription Affordability Board will align with Maryland and Maine, as mentioned. You know, the state already reviews health insurance rates increases, which has saved Oregon consumer hundreds of millions of dollars in unjustified premium increases over the last decade. It's time for drug prices to get the same level of scrutiny. This is a well-crafted plan. It's a collaborative plan. It is a plan Oregonians need. We must address rising drug costs and we must reduce health disparities, and this legislation will do both. Thank you.